Chula Radio Plus presents Chula Innovations Unlocked.
Inclusion is one of the key words towards developing a sustainable society. One group of people who are consistently calling for social equality, inclusivity, and understanding are transgenders, many of whom feeling they are still neglected by society and underprivileged in some aspects. And medically speaking, trans people may need certain special care when it comes to certain health issues. This is why King Chulalongkorn Memorial Hospital has founded a gender health clinic in collaboration with faculty members from the Gender Medicine and Menopause Department of Obstetrics and Gynecology, Faculty of Medicine, Chulalongkorn University, to provide a comprehensive healthcare clinic to underline the importance of transgender in Thai society. While another unit, which acts as a think tank to serve transgender people, is the Center of Excellence in Transgender Health, or CETH, which is another body that acts as an international research center. Today, we talk to Associate Professor Dr. Krasian Panya Kamler and Assistant Professor Dr. Amarin Suwan, both of whom are reproductive gynecologists and sexual medicine specialists and founders of the Gender Health Clinic and the Center of Excellence in Transgender Health. Dr. Krasian, Dr. Amarin, first of all, thank you so much for your time and welcome to Chula Innovations Unlocked. Both centers that we are going to be focusing in our program today focuses on offering consultation and services to the transgender people. How did this idea come about?
I think 5 years ago, we created the Gender Health Clinic in King Memorial Chulalongkorn Hospital. We know that in the past, in Thailand, we have a lot of LGBTQ people. And even especially for transgender people, I think about 500,000 people in Thailand.
Right.
I think we have a lot of LGBTQ in Thailand and in Asia.
Right.
But we have no standard of care. Especially for healthcare from the healthcare provider.
Right.
And then I and Dr. Amarin and my team create the Gender Health Clinic to take care of all the LGBTQ patients in Thailand.
Right, and when you say you take care of, it not only offers consultation, but also surgery as well. Can you elaborate on that, please?
In our hospital, in Chulalongkorn Hospital, we have a lot of team of medical doctors. We are both of as gynecologists. Also, we have endocrinologists. We have pediatric endocrinologists. We have psychiatrists, and we have surgeon, plastic surgeon, colorectal surgeon, and breast surgeon to take care of all of transgender people.
Okay.
Yes.
Dr. Amarin, I'm sure that you have received so much praise from the LGBTQ community, but were there any other oppositions from other members of society following this project?
I think just only in the past. I think in the last decade, we improved not all the healthcare providers, but the social accept a lot of transgender, LGBTQ in the society.
Right.
So I think in the past 10 years, it's a good news for population of the LGBT so much.
See. Now, I understand that psychiatrists are called upon before a sex change. Why is that necessary?
You have to evaluate by psychiatrists first, because psychiatrists will evaluate all of their mental health problem, and then psychiatrists have to size that these people have to stay in that the way of living, about more than 12 months.
Gender.
Yes. In transgender men, they have to stay in from women to men. They have to stay that living is in that men and that's condition. Yes.
Right.
And then the psychiatrist will evaluate.
Right.
There's because if we have sex change by surgery, and then 1 year later,
right.
that man or that woman come here and they want to reverse the operation.
Right.
How can you do?
There's no undo button.
Yes. Then we have to make sure that they want.
Right.
They want to change.
I see. And
yes.
if the psychiatrists don't agree to sign,
we cannot do operation.
You can't perform.
Yes.
Because we found in our research in transgender women, we found around 22% have the major depression. Yes, so quite high compared to the general population.
Okay.
And the trans man, we found around 14% have depression.
Okay.
So we need to explore the underlying psychiatric disease first
Okay.
before we're gonna do this operation.
Okay. Were there any other interesting findings following your research during these 5 years?
Because just we found that a high prevalence of depression and anxiety in our population. So now we screen the anxiety, screen and depression in population in our clinic.
Okay.
Because we found that the higher prevalence. So we need to treat first.
Okay.
In some patients, after treat of depression or anxiety, they say that they don't need to change gender or something like that. So we need to confirm first.
You mean once you solve the depression issue, they come back to being heterosexual? Or-
In the minor of the population, but in the majority, when they say they are LGBT, it's fine, it's okay, it's correct.
But no need for a gender operation change.
Yes.
Okay. Is there a minimal age for people coming in to use your services?
We have even in childhood, the kid,
Okay.
the parent being them, or being him or being her
Okay.
here, and some parents talk to me that they don't want their kid to change, but some patients accept.
Okay.
We have to discuss, make the decision with all of the parents and with the kid.
Okay.
If you are a boy,
Okay.
but you just 8 years old, and you want to be a girl.
Right.
What about your parents? What about the thinking of your parents that you allow them or him to change?
I would really wait for that person to reach maturity.
Yes. I think so, because we have some hormonal regimen to suppress the puberty. It means that if that boy want to be a girl, we can suppress use hormone suppression not to be a boy.
Okay.
And then we give estrogen.
Okay.
We give androgen to be make him to be a girl.
I understand.
I think we should classify to the childhood transgender, and teenage transgender and adult transgender.
Okay.
In terms of hormone treatment, it's so different so much, because in the childhood transgender, we need only the multidisciplinary team to treat just family, society, school, or something like that. We don't need the hormone in childhood transgender. The hormone's gonna start in the teenage transgender.
Okay.
That Professor Kasian said we should suppress endogenous sex hormone when they enter teenage.
Dr. Amarin, I've heard that many health professionals are very concerned about transgender people taking hormones. Why is that a thing?
Yes, because the type of hormone is the main concern. If you use the wrong hormone in the body, the risk of clotting disease, the risk of heart disease increase significantly.
Right.
So we should consider the safer hormone for transgender.
Okay.
I mean that if you buy some combined pill from a dark pharmacy,
Okay.
you're gonna have the risk of the clotting disease.
Oh.
But if we switch to the natural hormone, the
Okay.
risk is lower, around 24 lower risk of clotting disease.
That's a quarter lower.
Yes.
Okay.
So I think the safety concern of the hormone use is very important problem.
I see. Now, taking birth control pills. Born a male, taking birth control pills so that that person could become more feminine. Right or wrong?
We don't need to use the birth control pill. We need the estrogen, right? But the estrogen in the birth control pill is different from the natural estrogen.
Okay.
We should move to birth control pill to natural estrogen is the best way.
Okay, and then estrogens, lots of people buy them online. Where do you come in on that?
I think nowadays we have the services in the public hospital. The quite is so cheap. So I think if possible, I prefer to the LGBT population go into the public hospital. You can buy the safe drug and save for your money too.
Apart from Dr. Krasian Panyakamlert and Dr. Amarin Suwan, another reproductive gynecologist and sexual medicine specialist, Dr. Thanapop Bampen Kirtikun, who works closely with the Gender Health Clinic and the Center of Excellence in Transgender Health, will offer the definitions of terms related to transgender people, as well as briefly tell us about the process of genital surgery or simply as we know it, sex change.
For the transgender people, they might be diagnosed with the gender dysphoria, meaning that they have distress or dysphoria about having the genitalia or that they do not seem to belong. So for the option of the genital surgery might be divided into two types. One is to create a new vagina for the trans feminine people, and the second is to create a new penis for the trans masculine people. For the new vagina, we can create a new vagina using various types of tissue, like using the penile skin inversion inside, or maybe we can use the colon, the intestine, and with many more tissue like the peritoneum lining, the scrotal skin to create the length of the vagina. And for creating the new penis, we can create the new penis from the enlarged clitoris, which is the effect of the gender-affirming hormone therapy. Or maybe we can use the tissue flap from other part of the body, like from the belly, from the back, from the thigh, to create the new phallus or the new penis. After surgery, the transgender people might need the lifelong hormone therapy because they have gonadectomy, removal of the gonad already. So after the surgery, they must have a follow-up visit with the endocrinologist or the sexual medicine expert to take care of their hormone, to affirm their gender identity. And also after surgery, the surgeon will take care of the surgical outcome, like the surgeon will take care of the new vagina to prevent it from stenosis, the obliteration of the vagina, and also take care of the surgical wound for the trans feminine and trans masculine people.
Can you help define the words like sex, gender, and words related to the LGBTQ community, please?
Okay. For the gender diverse people, there's so many terminology about sex and gender. If we talk about sex and gender, the first thing is the gender identity, which is what they feel inside, that they feeling that they are a man or a woman, or neither of them or both of them. That the first one is gender identity. The second one is the gender expression. It means that they express femininely or masculinely, depends on the society, what the social expect from them. The third one is the sexual characteristic. It is formally known as the biological sex or the sex assigned at birth. This one is a sex that the doctor or other people assign for the person from the day that they were born. It might be the sex from their genitals, from the appearance, or from their chromosome, or from their predominated hormones.
Now, coming back to Dr. Krasian and Dr. Amarin, before we ask why trans people should choose to receive consultation and services at major hospitals, let's start by asking about an easier topic, misconception. What is the biggest misconception amongst LGBTQ people, especially transgenders?
They're concerned about the exception, you know. I think most of Thai people still have some argument about the exception of this kind of people.
You mean social acceptance?
Yeah, so society. You know, when you leave, go out of the room, and then we will have a gossip. That man is the woman, that woman is a man, you know. This is they concerned about. And then why Dr. Marin said that we have a more prevalent of depression among this kind of people. Yes.
I think the big misconception is not from LGBTQ, but from the general population. First of all, I'm gonna tell you that LGBT is not disease, not disorder, just minority. It means they are normal. They are just only variation. So the general population gonna accept that the just variation in the society, just variation, not disorder. We don't need to treat them. We just service the health care for them.
I see. And how could members of society, other people, heterosexual couples, how could we support the LGBTQ community from your point of view?
Inclusion is the main strategy because in the past, we categorize the LGBT as a special population. They need to seek for the healthcare provider just only in the private sector. But now in the public hospital around the country, we have services for LGBT So I think in the past 5 years, it's very good news for LGBT society.
Okay.
For me, in my opinion, I think most of the people have to change their concept. You know, when you birth a child, everyone have the sex at birth. But what about the gender? Everyone can choose to be that gender. You know, I think sex and gender is not the same.
Right.
And what we call gender identity. Okay, you will have sexual orientation and the test. You know, you have the test of sexual. You may be heterosexual. You may be monosexual, or you may be bisexual. This is up to you. But I think everyone have equal of the quality of life.
Okay.
And everyone can choose what is in the future they want to be. A man, they want to a woman, they want to just have the lesbians or gay. That is a test.
Right.
I have to announce to everyone that the right of human right. You know, everyone can choose the gender. And for me, all of us are healthcare provider. My duty is to improve standard of life, standard of how to take care of these people.
So how is taking care of transgender people different from taking care of other people within society?
Oh, I think we have very it's a complex management of transgender people. You know, I ask you that you know, in Thailand, you know, most of the people accept LGBTQ people or transgender people or not.
Well, nowadays, much.
But in the past,
in the past, it may be a bit kind of controversial and challenging for LGBTQ people.
Yeah,
Yes.
I think some transgender people have to take the medication by themselves. You know, they bought from the internet or from online.
The hormones.
Yes, and the hormone, you don't know the name, you don't know the quality of the medication, you don't know that expire or the medication or not. You know, and then for transgender men, it means that women to men.
Okay.
They take testosterone by injection.
Right.
But they use the ampoule of the medication. You know, we have to use just single injection, but they use multiple injection.
Okay.
They just store the medication and inject by themselves, and then they keep the medication, the remaining medication in the refrigerator.
Okay.
And 3 weeks later, they inject it again.
Which is very
Dangerous. Because we have a lot of organisms. They may take the organism from the ampoule that they keep in the refrigerator, and they got sepsis or abscess from the injection side. Yeah, it's not good. Yes.
I see.
And then they know even the doses of the medication they take it. They don't know how to monitor the physical change. You know, you know, if you want to be a man, you are a woman. You have to know that you have to have your oily skin, acne. Your voice will be changed. You have the what we call hairy skin, or maybe you have the muscle mass, and then you have no mens.
Menstruation.
You know, every single woman will have menstruation every month. But this kind of people want to be a man. Then they don't want to have menstruation.
I see.
Then you have to know everything about the physical change and the blood change into the body. You know, and also in the muscle change.
I see. I see. So what services do you offer here?
In our clinic, we belong to OBGYN department and sexual and medicine division. You know, we have education for all the medical students, all of the OBGYN resident and other branch of residents, and we have fellow of sexual medicine. This is education. And so we have research, many research about LGBTQ and transgender patients. We publish more than 20 studies now to get the new knowledge of how to taking care of this kind of people.
I see.
And also we have the services we call gender health clinic here. We opened Chulalongkorn gender health clinic for more than 5 years, and now we have a lot of patients. I think nearly 1,000 patients each month.
1,000
come here.
New patients.
Yes, new patients come here because our service is on Monday afternoon and on Thursday afternoon. And also we taking care of the sex, you know, the sex the couple we have sexual problem.
Okay.
Even in just the
In heterosexual
the
couples.
cis women and the cis men and even trans men and trans women, we taking all of the sexual problem of this patient.
I think we emphasize on the research, not only that research that we did, but the ongoing research. We have many kind of research on the cardiovascular disease in LGBTQ,
Okay.
The mental health surgery or something like that.
Mental health surgery.
Mental health and surgery.
Oh, mental health and surgery.
Yes.
What is the most common STD among transgender people?
I think the even cis or transgender is the HPV. But anyway, the HIV, the syphilis, gonorrhea can occur in all population.
Right.
So I think it's not the issue to compare between the general and transgender because it's not depend on the gender identity. It depends on the sexual behavior.
Okay. Compared to other perhaps smaller aesthetic clinics, how is your service here at King Chulalongkorn Memorial Hospital and Chulalongkorn University different?
I think the strength point is we have a lot of doctors in our team because the first objective is multidisciplinary team for service all aspects of the transgender.
Right.
So I think the strength is that we have a lot of all fields of doctors
Real
who provide.
professionals.
Yes. So I think, and the second one is the price, because the transgender can access the service in the public hospital, so the price is so affordable.
Half?
Affordable for LGBT.
Like
yes.
half the price of other clinics?
Maybe some hormones, some medication, maybe half.
Right.
You know, we are government hospital.
Yes.
We work in government hospital, Chulalongkorn Hospital, and then the price of that the patient have to pay is very low, you know. But the standard of care is excellent because they will be take care of medical doctor. Because I'm the medical doctor, he's a medical doctors, and we have this is in Chulalongkorn Hospital. We have a lot of tertiary care. We have a lot of devices that really high standard.
Right.
And then I think in the future we will be the hub, not even in Thailand, but I think in Asia.
My last question is, what is the next step to bring your centers to the next level?
I think we need the local data about the transgender in Thailand because in the past we need the data from the Caucasian, from European country, United States, something like that. But the different culture, different idea around the world, I think is the main component when we taking care of the transgender people. So if we have the data in Thai transgender, we have to make decision on treatment, on surgery, mental health. I think we gonna have the data before we prescription any medication or surgery.
I see. So information collecting to data which results in perhaps development in research and then the best cure for transgender people.
Yeah.
We need many cooperation for many division or for many part of Thailand.
Right.
You know, want everyone to know, even in ordinary people to know that we have this care in Chulalongkorn Hospital.
Right.
We have the meeting, we have academic meeting, we have many researchers to improve the quality of taking care of this kind of people.
Right.
Yes.
I'm sure that this is very life-changing and what you're doing here is very much not only important for the transgender community but also for the whole society as a whole. Wish you the best of luck. Thank you so much, both of you. ขอบคุณมากครับ
Chula Innovations Unlocked is produced and presented by Super John Klinsawan. This program is brought to you by Chulalongkorn University.